Bridge, and we're headquartered here in Worcester, Massachusetts. And we're joined by our sister company in Glastonbury, Connecticut, Catalyst Benefits Consulting Group, which is led by John Fitt. So on behalf of both of our offices this morning, we just wanted to welcome you all and thank you for attending. Before we get started with today's presentation, as you always, there's just a few housekeeping items that we do like to go over. First off, please just remember to mute your telephone lines and computer microphones during the presentation unless you are asking a question, because they do sometimes cause feedback on the line and make it difficult to hear the presenter. Secondly, there are a few ways to pose a question on today's call. There is a question box on the right side of your screen in the GoToMeeting menu, and you are welcome to either raise your hand if you have a question on it, or go ahead and post the question in, and we will address it either during the webinar or when the webinar has completed, whenever there's a lull in conversation and we can get it in there. Also, you're always welcome to send questions to myself after the webinar, and we would be more than happy to get those answered for you and get them back over to you. And lastly, the takeaway for today's webinar are downloaded on our website, the presentation, the slides. We do record our webinars and would be happy to send it out to you at your request as well. We do try to post them on the website, but sometimes technology does not allow for it. So if you don't see the actual webinar posted under there, we do have them and you are welcome to them. You just have to ask. So today I just wanted to introduce our speaker. Jennifer Reed joined Electronic Commerce, Inc. in October of 2013 as a manager of strategic partnerships and alliances after 10+ years in the employee benefits field and 5 years of HR technology consulting. Jennifer grew up and worked remotely for ECI from North Texas. After graduating from Austin College, she started her career in employee benefits at Cigna Healthcare. And while at Cigna, Jennifer was promoted to supervisory role and put in charge of resolving escalated customer service issues. She worked directly with key accounts, and before leaving Cigna was chosen as one of 3 individuals to actually be part of the first inside sales team for Cigna, which launched their small group market in Texas. From there, she worked briefly for Instant Benefits, which was acquired by PlanSource in 2008. She was tasked with selling a benefits enrollment platform to brokers, nationally speaking. And there, she joined ECI in 2008, and she has since worked for an HR technology consulting firm in Boston, Mass. While there, she consulted with over 600 employers, ranging in all sizes from 10 lives up to 16,000 plus, in the areas of HRS and integrated HRS and payroll and benefits enrollment. So while providing the technology consulting services, she did work intimately with ADP, Ceridian, Ultimate Software, Paylocity, ECI, and others, but chose to really make her sole focus working for ECI in 2013. So without further ado, as you all are aware, one of the pressing issues in today that a lot of us speak to in meetings would be reporting, specifically the 60-55 and 60-56 requirements in what your options are as employees. So I'm not going to waste any more time, and I know you're all waiting to hear it, so we'll go ahead and pass everything off to Jennifer here. And there you go. It's all you, Jennifer.
Great. Thank you for the introduction, Brooke, and good morning, everyone. First of all, I want to say that I appreciate you joining us today and taking the time to do this. I know that it's very busy schedule for you, especially with all the ACA requirements and things that are coming up. And I want to thank Aisling Partners as well for sharing you with us. I know it's an important step to trust your trusted clients, and I appreciate that. To start off, I want to give a little more background of myself, so you kind of know how this presentation is. Definitely a unique presentation. Some of you may have seen presentations done by attorney firms or even compliance resources. How mine is different is my background is definitely unique. Brooke mentioned that I worked for Cigna Healthcare. That's where I started my career in core benefits, and then I worked for an enrollment company. The HR technology consulting piece, I consulted for over 600 employers nationally, the large end being like Cabela's, if you're familiar with them, and Panera, but primarily in that 50 to a couple of thousand space. And so I've seen, if you will, all sides of the ACA reporting from a logistics standpoint, since I have a core benefits background on the technology side of it. And my role with ECI is to grow relationships with benefit brokers, HR consultants, and HR tech consultants nationally. So ACA is obviously near and dear to me, but I've also been a big part of that development for ECI, for our own customer base. As I'm going through this presentation too, I always appreciate questions. She mentioned that, so feel free to send those to Aisling. Not only am I receiving questions from all over the country from brokers, which is why I've gotten so strong in this area, but I'm supporting ECI's own clients, and Aisling and ECI both have a national benefits attorney as a reference to use as well if there's questions about the law or areas that we don't know on the spot today. I do want to give you a little background of ECI. I've made it all the way through the presentation before, and customers weren't aware of who we are and what we do, so I want to make sure to start there before we get into the meat of the program. So we are a human capital management company, an HRIS payroll provider. We have clients all over the U.S., about 600 clients nationally, and in fact, we were just approved for a $40 million investment from a private equity company. We are more of a mid-market focus, employers with 100-plus employees, and therefore we're in the thick of it when it comes to ACA. All of our clients are required to do the 655 and 656 reporting. As far as our product, we offer a full end-to-end, hire to retire, if you will, from recruitment, paperless onboarding, core HR, payroll, benefits enrollment, learning management, performance management, time and attendance as well, and we do offer full the outsourcing type model, if you will, for ACA reporting. When I get to the end and I'm covering options, just keep that in mind, because I'll explain kind of the differences between the two. Why I chose ECI. I'm not going to spend a lot of time on this, but I just wanted to point out, I worked, with all different companies, ADP, Ceridian, Ultimate, probably any of them that have called you or that in the area. Why I chose ECI over the others. ECI's name has never been as known nationally, but because of the type of relationships that I grow, with brokers and consultants, I had to pick a company that did a great job on implementation. And so that's the main reason why I chose to work for ECI. 3 of these customers that you see in front of you, Grand River Health, Kirby Lane, even the last, which is the American National Bank of Texas, the reason why I'm showing you these 3 is because these were consulting clients of mine prior to ever joining ECI. And I'm really proud of the fact that they're still happy ECI customers as well as referenceable. So even though we have a 98% retention, and I always say that, every vendor says some number between 96 and 99, so that number has almost become, it doesn't seem like it's powerful. And so I like to point out to you, I think it's powerful that 92% of our customers are referenceable. And to me, that holds more weight. Now to get into the meat of the actual reporting requirements. I'm going to start with a baseline to make sure we have a baseline understanding before I get into the logistics. I'm going to spend a lot of time on the 1094C and the 1095C, and at the very end, I'm going to cover options that are out there and things for you to consider as you're looking into options in this space, and kind of give you a look behind the scenes of what happens from a technology perspective for companies like ours and other ones that are out there. To start with that baseline, the first question that always comes up is, why, first of all, why do I need to do this at the employer level? One key thing for you to understand is that, all the ACA reporting really comes down to this. Individuals that are currently enrolled in public exchanges and receiving tax subsidies, individuals are required by law to have minimal essential coverage, and employers are required by law to offer affordable minimal essential coverage and minimal value. Without this reporting from the employer level, there's no way for the government to determine if the individual are actually eligible for the subsidies they're receiving now, or if they're even enrolled in some insurance, or if the employer is providing the insurance. So really, this reporting is key to the entire law, which is why all the penalties were delayed when the reporting itself was delayed. The most important part that I want to get across today and I've been presenting to employers nationally and brokers nationally, so I'm got a very strong opinion in this area, is that there's a lot of companies that are out there waiting. And I think that's for a few reasons, but I want to be very clear as why you need to be focusing on it, or at least understand what it is today and start tracking it today. First of all, this year, the calendar year we're in right now, is going to be the first year that's going to be reported on in 2016. What's unique about this part of the law, there's lots of pieces of ACA that you hear about when you're talking about affordability, tracking variable hour employees, and unfortunately some industries are affected by all pieces of it, like retail and hospitality and restaurants. But this piece of the law, when we're talking about the end of the year reporting, affects every employer that has 50 or more employees, full-time employees, otherwise known as an applicable large employer. Whether you offer insurance or not, you have to do this reporting. Regardless of what industry you're in, whether you pay 100% for all your employees' benefits, you're required to do this reporting. And that's why this piece of the law is so important for you to understand regardless of your situation. Now, employers that are between the 50 to 99 space may qualify for transition relief for this calendar year. If you don't know at this point, you definitely want to speak to your broker or AISling. That way you can decide if you qualify for that. But even if you qualify for transition relief, you still, for this year, have to send the reporting to the IRS for next year. There's a code you use for a transition relief, but I just want to make sure that's clear because I have a lot of questions that come up on that. At this point, hopefully you know if you're an applicable large employer or not. If you have multiple EINs and you're still trying to determine if you're an applicable large employer based on a control group, you definitely want to talk to a ERISA counsel or take a look at that. There's a lot of very unique pieces that go into that, and it's more complicated than it seems. And that's something that I want to point out. That's not something that your vendor or anyone else should really do that analysis for you. Also, it applies to self-insured employers with less than 50 employees. Employers that are fully insured that are less than 50 really don't have to worry about this reporting, other than just being aware, because their employees will still receive a form, if not from the insurance carrier. But from an employer perspective, it applies to the self-insured less than 50. And the big reason why you need to worry about this now, when you're talking about like W-2s and W-3s and payroll reports and things to the IRS, when you come up on the tax year, you can always go back and gather the data that you need in order to do that. What's really hard about the ACA reporting is the month-to-month tracking of data that some employers aren't even tracking today. It will be very, very hard in January to come back to January of this year and pull some of this data if you're not currently tracking it in a way today, even if it's in Excel. That's the big reason why you need to be ready and understand it now. Some examples of that, the easy components to kind of go back and get are total number of full-time employees, total number of employees. The hard pieces, and I'm going to go more in detail on these, is tracking the offer of coverage at the employee level on a month-to-month basis, or enrollment information on a month-to-month basis of not only your employees, but their dependents and spouses. Before we get into the actual forms, I just want to remind you some acronyms. ACA is full of acronyms, and I provided these slides to Brooke as well, so you can even pull out this slide and keep it as a little cheat sheet. Hopefully everyone on the phone knows now what the acronyms ACA and PPACA are. The three that are used a lot throughout the forms, and I'm mainly giving you this because I got halfway through the presentation one time and had someone stop me and go, Jen, what does ALE mean again? And so I want to remind you before we get into that piece of it, because a lot of these are used not only verbally, but they're actually embedded on the form. So if you see ALE, that stands for applicable large employer. MEC is minimal essential coverage, and MV is minimal value. Now, minimal essential coverage, all you really need to remember about minimal essential coverage is that generally it means if you, as an employer, offer insurance, it's considered MEC. So that definition is actually pretty easy. As far as minimal value is the 60% of actuarial value and is met when a plan pays on average at least 60%. I'm not going to cover minimal value today. This is more of a reminder. If at this point you're unaware if you offer minimal value insurance, you definitely want to check with AZLIN, because I'm sure there's a lot of calculators and things that are available to easily figure that out, because you need to know both of those components prior to ever getting to this reporting. Okay, to start on the reporting, so I'm going to start with a form cheat sheet. You know, there's a lot of forms, 1094, 1095, B, C, A, and it really gets confusing. And I like to simplify it for you so you'll know exactly where to focus in on. And if you're doing the reporting in-house, you want to know which forms do you For those of you in the line, we're just having technical difficulties. Just give us a second.
We get back to you yet there?
No?
Well, you know what, Jen? I'm not entirely sure what happened, so let me go ahead and bring up your slides until we can figure it out.
Okay.
How's that?
I cannot see your screen yet if you're sharing it.
Oh, you know what? Let's do this. Why don't you keep talking, and I'll email everyone the slides.
Okay.
It doesn't seem to be connecting to the screen for some reason.
Okay. So I'm going to go ahead and continue. On the 1095, the employee statement itself, you know, it's about the individual employee. I like to compare it to the W-2. Or, you know, if you're self-insured less than 50, you have to do it for anybody that's enrolled. But for the 50 or more employer space, and that's more my focus for this piece of it, you have to produce a 1095 for every employee that was full-time 1 month during the calendar year. So unlike a W-2 where you have to do it, you know, for any employee, including part-time. A 1095, you do it for, if they're full-time 1 month out of the calendar year. Or, by the way, for the self-insured space, for employees, even if they're not full-time 1 month out of the calendar year, if they're enrolled in your plan. And I'll talk a little bit more about that in details as well. For the 1094 and 1095 for the B forms, I'm not gonna focus on those today, but I want to point this out because there's been some changes with the final instructions. So just to make it easier for you, the ones from an employer perspective, the ones that use the B forms are only for the self-insured that are less than 50. Now, for those of you that are larger than 50 that are self-insured, you have an option to use the 1094, 1095 B forms for those non-employees that are enrolled on your plan. For example, if you have someone on COBRA and they're close to the 18 months, so they weren't a full-time employee one calendar month of the year, you can use the B forms. I want to point out that optional piece, though, because that's a big component, because once it became optional and not required for you to use the B forms for the non-employees, companies like us and probably all the ones that are out there entirely focused our development on the C forms. So we're no longer at ECI even producing the B form since it was optional for that larger group. And many organizations like ours may have done the same thing from a developmental standpoint. And from your perspective, it's also easier just to focus on the C. Not worry about all the different forms and the different types, and just focus on the 1094C and the 1095C, because it's mainly for simplicity reasons. So from there, for that reason, I am going to go into the C forms and focus only on those. For just a little tip, for those of you that are interested in the B forms or have to do it if you're less than 50 self-insured, the C forms cover that information as well. So if you know the C, you know the B, and that's another reason why I focus on the C. But so it won't be a loss, if you're sitting on this webinar now, because everything that's on the B is also covered on the 1095C. Now I'm going to start focus in on the 1094C, which is the employer level aggregate form. And for those of you that don't have the slides in front of you right now, if you want to, it will help if you pull up the actual IRS forms. When I presented a seminar, I actually just print those out so everyone can see them. So if you have that in front of you as I go through these fields, it will help a lot, because you really visually need to be able to see them in order to know where I'm going at, and it will help you remember as well. So the 1094C, as I mentioned, is the employer level aggregate form. So the top part of the form is just basic employer information. So I'm going to gray that area out. An area to point out that I want to teach you a little bit about, and in the second part of the first page on the 1094C, you'll see that part 2, ALE member information. In line 19, it says, is this the authorized authoritative transmittal for an ALE member? Anytime you see ALE member, that terminology in the forms is really referring to, I'll simplify it for you, an ALE member really means EIN. So for those of you that have multiple EINs, anytime you see member, you have to understand that the 1094C, you're going to complete one 1094C for every EIN that you have, and a 1095C for all the employees that go under those EINs. In line 19, when it says, is this an authoritative transmittal for the ALE member, I want to point that out specifically, and by the way, that definitely falls to payroll, obviously, because that's where you have the division on the EINs and where that's even tracked. But I want to point out that line in particular just because, even that line at ECI, when we first started developing our ACA reporting, there was some back and forth internally as far as what that meant. Because when you're deciding if you're an ALE and you have multiple EINs and you're part of an aggregate group, this part of the form actually is confusing initially, because it seems like that what that means is that you're supposed to add up or accumulate all of those employees and all of the EINs into one authoritative transmittal. And I point that out because it's absolutely not the case. It is considered an authoritative transmittal. 99.9% of the time, it's always going to be checked yes. The only situation when you would not check yes let's say you have one EIN and you have one location under that EIN that's maybe using, a payroll company, ADP or whoever. Under that same EIN, another location may be using another company, and those two companies may submit the reporting individually, even though they're under the same EIN. And so you, in turn, would have to submit an accumulative one that encompasses both of those organizations under one, because you have to have one 1094 authoritative transmittal per EIN. That situation is very rare, because most of the time, if you have a structure like that, each location has its own EIN. I'm sure you're aware. So it is, the reason why I point that out, why it's confusing, is because if we didn't have a national benefits attorney as a resource that we ping that back and forth off of, from a developmental standpoint, we may have developed that in the wrong way. And so if you're looking at organizations that provide reporting, you definitely want to ask questions like that if they have resources like that, because even in the attorney space, because this law is so complicated, some attorneys may even have different answers for different areas like that. And you definitely want to make sure the company that you're working with has a resource that cannot be disputed like the one that we're working with. On the second page of the 1094-C, this is where you really have to start reporting at the employer level at a month-to-month basis. And I'm going to point out a couple of things on this page to really get you thinking as far as where that data is and how it's stored. So starting on column A, that's actually the easiest column on this form. Remember how I defined what minimal essential coverage is? That most likely is going to be a yes or no for you for all 12 months. Either you offer it or you don't. When you get into the full-time employee count for ALE member, now remember, ALE member means this needs to be on a per EIN basis, and so you need to provide the full-time employee count on a month-by-month basis for the whole year. The bottom of the form is just cut off on my screen print. And then you need to provide it. Now think about what the definition of a full-time employee is according to ACA now. The definition of a full-time employee is they work an average hours of 30 hours per week, 130 hours per month. The definition changed according to ACA. Those of you that have to track variable hour employees may need to include, time and attendance. TLM stands for time labor management. So that piece may be a component for you in order to figure out, your full-time employee count for an ALE member. For the rest of you, you can probably get to that number just using payroll, from your payroll data. But the reason why I have time and labor as a component of that, I'll give you a little window to why that's important. So at ECI, we have an average hours per week, average hours per month report. That's a standard report for any customer that needs it. However, when we were developing that report, what we did is we created an interface from our time and labor to where it came down to a day format. And the reason for that, if you think about it, most payroll cycles for employers are in semi-weekly, bi-weekly, 2 weeks of data. That 2 weeks of data may cross a month, may cross a week. A payroll week never starts on a Sunday or a Monday. And so when you're talking about getting to an average hours per week or average hours per month, the only true way to get an accurate average hours per week, average hours per month is if you take the hours down to a day. And what I mean by that, so if you're using a time and attendance system, for example, a lot of our restaurant clients, have to use POS systems. Other companies are using other systems. They're tracking it manually. The way the data comes into payroll will determine how accurate the vendor can produce a dashboard or report in this area. Because the data usually comes in a bulk, if you will. So we'll see 2 weeks of data, not 1 week of data coming in from a time and attendance. So it's important for you to dig in on any of those dashboard reports, ask them if they have the rules built in. There's also exceptions to the rule that go in this full-time employee count. So for example, if you have an employee that's on FMLA and they're unpaid, those hours, there's a couple of different ways you can do an average, for those hours, but those hours should be included in those average hours per week. And you want to ask those questions when you're looking at vendors like that, or at least involve your broker in those discussions, because your broker may not understand the technology component of it, but they understand the law, and they can ask questions that you may not think about when you're reviewing solutions like that. Column C It's total employee count for ALE member. So this is full-time, part-time, any employee on a month-to-month basis. Why I show that comes from payroll and HR, if you're thinking about payroll, if you're using a system, same example in FMLA, you have an employee that's out, 2 months on FMLA unpaid, they may not show as an active employee for that month in just a payroll system. So that data really needs to come from payroll and HR. And HR may be Excel, it may be a system, but you want to make sure that you're including both, the employees that are paid and the ones that are considered an employee that may not be receiving a paycheck for that month. The last page of the 1094-C, and this is for those of you who are an aggregate group that have multiple EINs, when you submit an authoritative transmittal for one EIN, you just list the other organizations in the EINs that are tied into that one authoritative. So if you, like EIN A, you're going to list all the other ones, B, C, D, that you have tied in. EIN B, that you're submitting an authoritative transmittal, you'll list A, B, D, D, all the other ones that tie into that one. Now, the 1095-C. Now, this employee statement is the hardest part. Now, if you remember, when I was looking at the 1094-C, what's so hard about this law is the 1094-C, primarily that data comes from payroll, HR, time and attendance for some of you. But when you flip over the 1095-C, and this is for the actual employee statement that I talked about, it's about the individual employee, is that this is benefits information. Primarily, every piece on this form is going to come from benefits information. Now, if you remember, I did consulting for about 600 employers nationally. So whenever I was doing consulting for employers, and this is HR technology consulting, when I got to the benefits enrollment piece, I would go through their current situation and I would ask, okay, where are you tracking your benefits today? 9 times out of 10, I would have the HR director go, we're tracking that in Excel, or we have it in paper, or what do you mean? We're relying on the carrier. And that's why this part of it is going to be so hard for some organizations, because there's some data needed on this form that you may or may not be tracking today. Now, those of you who are using benefits enrollment systems, you're at least tracking probably the majority of this, so you have an electronic way. But I know from working with employers for many years that most of you may not have an automated way to do this today, and that's why it's tough. Even if you're looking at a solution now and you're thinking about launching one now or one next year, you have to think about, because you still have to do the reporting for this year. We're already in June, and so you have these previous months of data that you need to go locate if you don't have today on your individual employees. Where this gets the hardest, of course, is organizations that have a lot of EINs, a lot of turnover, a lot of change that are growing, because literally on a month-to-month basis, if you made an offer, if an employee's part-time January through April, and then you made an offer for insurance because they flipped over to full-time, you're going to have different codes in these months, and it will flip over, whenever they hit full-time that you made an offer, whether they enrolled or not. Another key point I want to start before I dig into the actual codes and some of the logistics. Remember the 1095-C, you have to produce one of these for every employee that was full-time 1 month during the calendar year. And I've had some questions, too, about whether the carriers are going to do these forms and things like that. I think there's some confusion out there, so I want to make this point. The insurance carriers, if you're fully insured, the insurance carriers are responsible to send a 1095-B to your employees, and what's on the B form reflects who's covered, this information down here. The carriers do not have the information to show if you made an offer. So, for example, if you offer insurance to an employee and they don't enroll, the insurance carrier doesn't have that information. And I point that out because even if the carrier is sending your employee a 1095-B, you as an employer are still responsible to send a 1095-C showing that you made an offer for 50 or more employees. So don't think because they're sending a form that it's taken care of. You absolutely have that responsibility as well. Now, for those of you that are fully insured, You only have to focus on Part 1 and Part 2 of this form. If you're self-insured and 50 or more, you have to do Part 1, Part 2, and Part 3. Now, the hard part of this is actually Part 2 because it contains data that doesn't exist now for some employers. So if you see line 14 on this form is where you show the offer that you offered insurance. And I'll give you a little window into the technology side of it, because remember how I said ECI does benefits enrollment and payroll? So our benefits enrollment customers, the way we're handling these forms for coding purposes, if an employee enrolls or waives for our clients, then we'll default in the offer for that month and for the rest of the year. And I point that out because the only way for you to really know about the offer is not just enrollment data, but if an employee waived benefits. And the waive is really more important if you get audited, if you have to prove that you offered insurance. But from a tracking perspective, you definitely want to track those employees that waived or enrolled, so you'll know whether to put a code for them as far as the offer of coverage for that month and for the rest of the year. Couple of things too. You see that there's different codes. For those of you that are between the 50 to 99 space, remember me talking about the code for transition relief? If you see this 1I at the bottom, that's what that's there for. 1A through 1F are the majority that are used. You know, the qualifying offer, by the way, these are for those lucky employers to pay 100% as employee because they offer MEC, and if they offer minimal value and it meets affordability to, you know, spouses and dependents, then you can use 1A, and then you don't have to put an answer in 15. Most employers are going to fall into the other categories most likely, and you have to figure out, you know, which category works for you. And by the way, on these codes, I've simplified them for the report. You definitely want to go read the instructions if you're going to be doing this yourself for your organizations. They're not as short and simplified, and so I definitely want to tell you to do that. Now, there's one code needed in each of these boxes on a month-to-month basis for the employee. And I want to back up and talk about line 15 for a second before I get to 16. So line 15, you see employee share of lowest cost monthly premium for self-only minimal value coverage. That one actually is pretty easy for most organizations because it's going to be one answer for every employee. But I want to point out a few things. So see how it says employee share only of lowest cost monthly premium for self-only minimal value coverage. So I'll give you a perfect example. I, Jennifer Reed, you know, I'm enrolled. I have 3 kids and a husband, and I'm enrolled in employee and family for ECI's benefits. My cost that comes out of my paycheck would be the same thing as you call a payroll deduction. That number has nothing to do with the answer in line 15 because it needs to be my employee-only rate. And let's say ECI offers 4 different plan options. I may have enrolled in plan option C, but the answer is going to be your lowest minimal value coverage for 15. So you want to make sure it has nothing to do with what I'm enrolled in. It has to do with the employee-only rate for your lowest minimal value coverage. That's the answer that has to go in line 15. And yes, it has to be specific to this individual employee. The only place it gets complicated is that when the small group changes to less than 99, if the 50 to 99 space is individually rated, meaning that the employee's rate is based on date of birth, this answer may be different for different employees. Other than that, it's pretty simple. You know, it's probably most likely going to be one answer for all your employees. You just have to make sure you put the right rate. For companies like us, it's actually easy as well because we can point it to the field that stores that employee-only rate. Now, line 16. Line 16, you also have to put a code. And if you notice, 14 is showing the offer. So if you didn't make an offer, or if you offered and they didn't enroll, line 16 is showing which safe harbor you used. Now, the code that defaults everything, if you see 2C, if an employee enrolled in your coverage, you're going to use T2C and no other code. If that code doesn't apply, and the others do not, so if you see the others, employee not employed during the month, employee not a full-time employee, I want to point out 2D. For those of you that are using measurement periods or initial measurement period, that's the code you use, 2D. So if you have an employee that's in a measurement period and in the middle of the year they turn, you've measured them for a year and now they're considered full-time because they worked an average of 30 hours per week, your code will switch from employees in limited non-assessment period to, if they enrolled or your safe harbor at that point. So you definitely need to be tracking those measurement periods if you're tracking it and what month they're in it and what month they flip over to full-time and when you make the offer. 2F through 2H, if an employee is offered insurance and they do not enroll and none of the other codes apply, then you're going to use 2F through 2H. I point those out because I've done this presentation enough that sometimes employers have measured affordability but don't realize which safe harbor they've used. You want to make sure which safe harbor you're using because you have to put a code in there. Now, if you offer 100% for employee, it's not a big deal. It doesn't really matter which one you pick. But if you're worried about affordability, you want to make sure you know which safe harbor you're using to gauge your affordability, because if the employee is offered benefits and they do not enroll, you need to put which safe harbor you're using in that field. Now, the last part that I'm going to go over briefly is Part 3. So remember how I said if you're self-insured, you have to do Part 1, Part 2, and Part 3. So Part 3, this is the area that you're putting the employee, the spouse, the dependents, if they're enrolled on your plan. And you see in that little column B at the bottom, this is where you put the dependent Social Security number. If you've asked for it, you have to ask for it twice and put it there if you have it. And the tough part about Part 3 is that you do have to know who's enrolled, who's covered on a month-to-month basis. And so you're literally going to mark whether they were enrolled on a month-to-month basis. The good news about Part 3 is that if you're not tracking this now, at least you can go get the data from the insurance carriers. That's the point that I like to make, is at least the carriers have this information. You can go get it if you have to report on it. The hard part about, too, is that if you're not tracking the offer of coverage, there's no one else out there that has that. That's something you have to track or go back and locate. So Part 3, at least you'll have a way to get this data from somewhere if you're not tracking it today. I'm going to move forward to some important points to make sure we cover these. So you as an employer are required to file Form 1094-C and 1095-C to the IRS and furnish a copy of the 1095-C to the individual employee. Just like you send them a W-2, you have to send a copy of the 1095-C to your individual employee. The dates, you must file the 1094-C and 1095-C to the IRS by February 28th, 29th for this tax year. If filing on paper, if you're filing electronically, by March 31st, so you get an additional month there. Form 1095-C must be furnished to the individual by January 31st the following year, just like W-2s. Very important point, if any of you have over 250 employees or at least close to that number, filers of 250 or more, and the law says specifically information forms. So an easy way for you to understand that, it means if you think you're going to produce 250 or more 1095-Cs, you must file electronically to IRS. And I'll talk a little bit about what that means, filing electronically. This is an area that companies like us, payroll companies like ADP, ECI, others, we're filing electronically on behalf of our clients no matter what size. But those of you who cannot outsource payroll for quite a few reasons, I know you guys exist accounting systems and things like that. If you're over that size, you really need to dig in and kind of figure out what that means for you if you have to get IT involved to file electronically. One thing I want to point out, because there's been a lot of questions about this, I want to make sure it's clear. This is on a per EIN basis. So filers of 250, remember it's on a per EIN, information forms must file electronically. So even if you have 1,000 employees, but each EIN doesn't submit 250, you can still submit paper if you really want to. The IRS released the draft publication for this electronic filing in April. I have the link in my presentation if you want to take a look at it. I've also included just a couple of screen prints in my presentation so you can just see a little bit of the code. And the reason why I did that is, I've had a lot of questions as far as what it means to file electronically with the IRS. And it's not like you fill out a PDF, save it, and upload it. It is definitely code. You definitely will need to get IT involved if you're required to submit electronically yourself to the IRS. The document itself, I think, is 40-something pages, and it's just a draft of the development code that you need to submit electronically to the IRS. And I wish you were looking at my slide now, because it's a slide of a lady sitting in front of a bunch of paperwork. ACA reporting options. So now what? How do I do it? What do I need to do to get ready? Are there things to make it easier for me? So for those of you that are considering going out and looking for a solution now, or you're looking now, I definitely want to give you some thought to think about before you do that. So a couple of things. You want to figure out what data you're tracking now and where it's at, where it's stored. Even if it's in Excel or paper, you want to figure out where it is and how can you get it into at least Excel or electronic format. Figure out what additional data you need to be tracking that you're not, and figure out if you're required to file electronically. That will be a big thing that may make you go one way or another as far as what product you're looking for or what would help you as an organization. And decide, of course, if you want to do this internally or if you want a vendor to provide this service, more of an outsource type model. For those of you that are processing payroll in-house and are considered doing this reporting in-house, things you want to think about, you may have to get IT involved if you're required to file electronically. You definitely want to dig into what systems you have in place now or what you may need. And even companies like QuickBooks probably have these forms in there now, to where you just need to find out what do you have and what do they do and what data are they missing. Because even companies like QuickBooks may have the forms, but if you remember by looking at the 1095-C, that's primarily benefit information. And even though they may be storing a deduction code for benefits, they may not have the other data you need. So you need to dig into those areas and kind of figure out what you need at this point. Those of you who want to outsource this and have someone else do it for you so you don't have to worry about it, a big place to start is, do you currently outsource your payroll? If you do, you want to start there. Ask if your payroll provider provides this service. Where am I tracking my benefit information? That's a big key, because even if you outsource payroll, it doesn't mean that the benefit information that payroll company needs to do your 1095-C is in their system. So you definitely have to remember that benefit enrollment information is key to this law. So you want to make sure where you're tracking that. Can your company track it? How are they going to be providing that to you? Options to consider. If you have an internal payroll system, you may consider replacing it with an HR payroll system. If that's not an option for you, and I point these guys out because I worry about these the most. The ones that have internal payroll systems, I know that a lot of you cannot move your payroll system. It's tied into accounting, or it's tied into your job costing, or for cost reasons. But those systems in general are typically the hardest ones, because they either don't do benefits enrollment, or on the large market side, it's too expensive for you to add that option to it if you're using like a PeopleSoft or an Enterprise. But you definitely want to consider potentially complementing your internal system with an online enrollment, if nothing else, to automate that piece of it, or maybe even look at a standalone ACA tool. And if nothing else, you definitely need to be tracking this information manually if you can't do any of those options that I mentioned. Things to consider, like I said, the internal systems that you use today, like ERP, Sage, Enterprise, SAP, any of those, accounting systems, Timberline's a big one used in construction industry. Those systems, unfortunately, most of the time don't do benefits enrollment, or employers don't use them because of the interface, or they're too expensive. That's a big challenge. And so you need to find out what your companies do, what they provide, and how you're going to kind of marry the two pieces of data together. Outsource options. If you currently outsource your payroll, first place you want to start, you want to review if you need to add on functionality with your current provider. That's a big one. I'm going to, like ADP, for example. ADP is a huge provider. They pay 1 out of every 6 Americans in the United States. ADP, because of their size, they've got a lot of customers on their older products, you know, the old PayX, PCPW, you name it. Remember what I said about the 1095-C? If you're using payroll only with a company, they're missing the benefits enrollment data that they need for the 1095-C. So you may need to add on additional functionality with your current company. Some providers are charging additionally for these services. You want to make sure you have that conversation now and don't wait until next year. So if you can't afford it or if you need other options, you kind of know what you're going to do in that area. An option, if you have a current payroll outsourced, you may consider replacing your provider with a stronger HR payroll provider or another option there. Or again, maybe you want to complement it with an online enrollment tool or ACA tool. Points to consider on the outsource model. Not all payroll companies are created equal. You know, there's a lot of local payroll companies that are rebranding and reselling someone else's software. And when I did HR technology consulting, you know, if I was talking to an employer with less than 100 employees, I would always tell them, hey, just find a local provider. You know, they have great service. They usually have what you need for just payroll. However, in this situation, the challenge with some of those providers is they don't own their own software. They're more of a service bureau, and they don't have the benefits enrollment component you need to do this reporting. And so you really need to dig in if you're using one of those providers, how they're tracking it for you on a monthly basis. If you're audited, how do you grab the data, how they're going to be doing the reporting for you. So you want to make sure this. One thing that's really challenging about this law is it's so hard and so encompassing that sometimes when a company asks a vendor, do you provide ACA services, and the answer is yes, it's like a whew, and they don't ask any other questions. And it's mainly because you're just so overwhelmed with what you have to do. But you really need to dig into some of these areas to figure out how these companies are providing the service for you, how they're tracking it. Because like those local payroll companies I was explaining, since they don't own their own software and they don't have benefits enrollment, they can't even create the fields that they need to track it in an electronic way. In my gut is that they're probably tracking it in Excel behind the scenes to keep some of their large customers. So you want to ask some of those hard questions in order to figure it out. Another big thing to think about is if benefits enrollment is done as a third-party system, and I pointed out that that's an option to way to automate, but most benefit enrollment providers are not doing the reporting. So if they're capturing the data for the 1095-C, you know, for the enrollment, but the payroll company is the one responsible for the reporting, the payroll company is still missing the data they need in order to do that. So you want to make sure to explore that option. How is it going to get, who's going to do my reporting? If you're going to do it in-house, it shouldn't be a big issue because they could pre-populate the forms, but if you have to file electronically, it might be an issue. Benefits enrollment vendors, you know, there's lots of them. I've mentioned some big ones up there. Benetrack, BSwift, Benefit Focus, Plan Source, you know, there's lots of Maxwell. You know, I did HR tech consulting for years, and I'm not knocking benefits enrollment providers because benefits enrollment providers better be better in benefits than we are in benefits enrollment because that's all they do. You know, I think about their best-of-breed provider, their specialty. However, when it comes to the data for this reporting, they're missing the data that they need, you know, for the 1094-C because that's primarily payroll HR data. So if they're doing your benefits enrollment and they're doing the reporting for you, what you want to make sure, how are they getting that information? Is there an interface? It's tougher on the reverse for the payroll company to do the reporting if they're holding the data, just because the interface that usually comes from benefits enrollment to payroll only holds payroll deductions. And if you remember my example of Jennifer, me being enrolled in benefits, my payroll deduction doesn't hold the information that I need for the reporting. So those are just areas you need to explore if you're considering these options. There's a whole new breed of vendors out there called standalone ACA vendors that are popping up, of course, as a result of this. Some more known ones are Equifax, Health Effects. There's quite a few others out there. These are obviously, just like BenAdmin, they're really good because they're strong in this area. They offer some front-end reporting, like affordability measurement periods. Some even offer best-of-breed modeling capabilities, which what that means let's say you increase your contribution by 10% and you want to model what that will look like from a penalty perspective on the backside, it's very impressive. The only thing I warn you about these, and some of you, this may be your only option. If you do payroll in-house and you don't do benefits enrollment, you may need a vendor like this just to make it easier for you. However, since these vendors are standalone, they don't do payroll, they don't do benefits enrollment, every piece of data that they're reporting off of is coming from somewhere else. So the data is only good as the data that comes in. So if you're using QuickBooks for payroll or benefits enrollment manually, you want to make sure to keep that in mind and ask questions as far as how does the data get into your system, what do I have to fill out. I've seen the Excel documentation that you have to upload to these, and they can be daunting, so you want to make sure you're tracking it, how you're tracking it, how it gets in there. Also, these vendors, unfortunately, the pricing for some of these guys tends to push them into the larger market space, 500, 2,000 plus space. And I know that the 50 to 2,000 space are the ones that need the most help, so that's a big challenge with those. My last piece I want to cover is the penalty, and it's my very last slide in the presentation if you're looking at my slide deck. Most of you may know about the 2,000, 3,000 penalty. You should by this point, if I don't offer coverage or if I don't offer affordable coverage. I want to make sure you're aware there is another penalty. The penalty is up to $100 per statement or return if you do this incorrectly or if you do not file. So if you remember how I said how you figure out how many 1095-Cs you have, if you're going to have 200 1095-Cs, your potential penalty is 200 times 100, and the max on that penalty is $1.5 million. Now, one thing that's good is this year, for this calendar year, there is good, limited relief provided by the IRS if you don't file, if you do make a mistake, if you don't file it correctly. But you must meet the filing deadlines. You must do it on time, and you must show good faith. So I always advise don't fall back on the fact that that you have limited relief this year. You want to make sure to get it correct this year if you can, and know that if you don't, you've got some relief there provided by the IRS. That actually completes my portion of the presentation, and I want to open it up and see if there's any questions that came through. Brooke, I don't know if you had any questions that you saw come into the panel.
So I don't have any hands raised here. Like I said, if someone has a question that, if you're like me, I know the second I, hang up with someone or shoot out an email, I think of 3 other things I should have said. So you're all welcome to absolutely send me a note once you've had a little time to digest some of this. So actually, it looks like a question just came in about unioned employees. Let me see here. Let me see if I can unmute you here, Michelle, and have you. Are you there, Michelle?
Yes, can you hear me?
I sure can. Why don't you go ahead and ask Jen just so you can get a better, it's easier for you to do it than me.
Okay. Hi, Jen. We have approximately 300 employees who are part of a union, and therefore they receive their health insurance coverage through the union. Do we still need to report on them? Because we actually can't offer them coverage because it's part of the collective bargaining agreement.
Great question. There is a code specific that I missed over because I didn't realize we had employers with unions on the phone. On line 16 in the 1095-C, 2E, that's for you, multi-employer interim rule relief. I will say that you are responsible from an employer perspective, even though you have union employees, to do the 1095-C and show Part 1 and Part 2. But the union itself is supposed to provide the coverage information, who's covered, because you're not going to know. And I actually punted that question to Stacey Barrow, who's that national benefits attorney that I was talking about, because we've had a lot of questions about that as well, because we have a lot of clients that have that. About how that's going to work from a logistics standpoint, because how does the employer know that the offer was even made? And what we got, and they're nationally known, by the way. They teach ACA nationally. They've consulted for ADP and ACA, And he said that the logistics as far as how that would happen, how the employer would know the offer may have not been worked, he doesn't know how that's been worked out between the unions and the employers yet. And so it is something that there's not an exact answer at this point, unfortunately, for your organizations. But from a law perspective, you are required to fill out the 1095-C and show the offer code, and then put the 2E in the multi-employer interim rule release. Hopefully you know at least when your enrollment period is and which employees would have at least gotten an offer. But
okay.
All right. That's something we'll have to explore further probably with that attorney.
Yes, definitely. Thank you.
And through ACE-Link, sure.
Do I have any other questions on the line? Again, if you have a question, you can just raise your hand. That would be great. Just give it one more second here. All right, Jen, well, I appreciate your willingness to do the webinar, and I'd like to apologize first to everyone. We confirmed that GoToMeeting was having some issues, and which made it impossible, really, to show any screens. So hopefully you all received the slide deck that I sent out and was able to follow along. We're going to try to figure something else out. Jen, I'll talk to you after the presentation and see if we can figure something else out. I know we had gotten a handful of other people who had asked for it. So again, we apologize. I wanted to thank you, Jen. We really appreciate your time. It's such an important topic, and I know we've had a lot of questions and discussion surrounding it, so we're happy you were able to clarify some things. And again, just so everyone knows, we do have the slides up on our ACA University website, which you're welcome to go download. We'll work on perhaps doing another recorded version so we can get it out to a bunch of these people who have been requesting them. And please keep an eye out for the next ACA University class and those alerts that go out. And if you ever have any questions, feel free to get back to us. All right, so thanks, Jen. Thanks, everyone, for participating, and have a great afternoon.
Thank you, everyone. It was my pleasure.
Thanks.